Show.
It's Wellness Wednesday in 2024. We are on track. That's right, trying to get your health on track. Joining us this morning is the one and only member of Alpha Phi Alpha Fraternity Incorporated, graduate from Morehouse. Man, I love this man right here. One of the best doctors in the United States of America, the one and only Dr. M.J. Collier. Dr. Collier, good morning.
Good morning, you Smiley. Good morning,
Happy to have you this morning, man.
Thank you so much, Ricky. I appreciate the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Ricky, we got a hot topic today, and this is something that we need to share with all the listeners. Throat cancer. Throat cancer is one of the fastest growing cancers, and it's often linked to the HPV or human papillomavirus. So we've noticed an uptick in this. I noticed it in my practice now. I have several patients that have suffered and are suffering currently from an oropharyngeal cancer in the head and neck that can be divided basically into two categories. You got HPV-associated and non-HPV-associated cancer. And that's important because you treat them in different ways. But there are three ways to reduce your risk and help prevent head and neck cancers, Ricky. One, tobacco and alcohol use increase non-HPV-related tumor risk, while HPV comprises 70% of head and neck cancers. So I've had patients that have had other cancers, including colon cancer, liver cancer, gastric cancers, and then ultimately developed throat cancers as well. So I'm not sure what the correlation is between that. That's just an observation in my clinical practice. But what's important about that? Again, they are very different biologically, and they are much more treatable. The HPV cancers are treated differently than the non-HPV cancers. So your treatment options include surgery, radiation, and chemotherapy, the traditional cancer treatments, but all treatment options are better if you reduce your risk of infection with HPV. So what are the three things you can do? Taken from Jeff Johnson. Three things you can do. One, no smoking of tobacco, no chewing of tobacco, no snuff or no tobacco pouches between your cheek and gum. Number two, minimize alcohol. And number three, finally get the HPV vaccination. So when the HPV vaccine was developed, originally they only concentrated on adolescents. They said, children should get it before they became sexually active. But now pretty much I recommend anybody that's sexually active and not in a monogamous relationship should probably get the HPV vaccine. It is very good in minimizing your disease risk for an oropharyngeal cancer. So it's also recommended to eat a healthy diet, Ricky.
Dr. Carl, that's why you said for mostly all cancers that vaccine helps?
Well, it does. There are several cancers that are HPV-related, cervical cancer in women, of course, and penile cancers in men. So HPV, and again, Ricky, my personal theory is that a lot of cancers are associated with viruses, and we just have not made that connection yet. I've been saying that for 20 years because it just makes common sense, in infectious disease states. So I think that since we have a vaccine for the HPV, I think it's very good that people should take advantage of that. I originally was not exactly pro the HPV vaccine, but I'm seeing the benefits that you have of it. So I've changed my mindset on it and recommend it now to all my patients.
Oh, wow. Okay. Yeah. That's good stuff.
You should eat a healthy diet comprised of whole foods and trying to minimize eating processed foods and refined sugars. I know Maria would like that. Okay, Ricky, so let's go to the questions from the listeners.
All right, you're on with Dr. Collier. Good morning.
Good morning. My name is Sharon from Lakeland, Florida, and my question is about women in their 50s and how to deal with menopause.
Okay, great question. As a matter of fact, that will be my next topic. I'm going to talk about a new initiative from Congress that's being headed by the beautiful Halle Berry. And so she made a presentation to Congress about that. This is a real phenomenon. It's a real syndrome, and it causes a lot of problems in women as they get into their late 40s and 50s. So the way to do that, menopause is basically decrease of your female hormones. The ideal way to treat that is replacement of those hormones. I'm not a big proponent of the traditional replacement methods, which is oral estrogens. If you have a uterus, you also get progesterone. But bioidentical hormone replacement, or BHRT, is life-changing and literally the fountain of youth for women. So I recommend that for all my female patients who are perimenopausal or menopausal to get bioidentical hormone replacement pellet therapy. That's a minor surgical procedure that I perform in my office and many doctors do now. It's become very popular. So just Google bioidentical hormone replacement therapy, and it'll talk about how you correct your hormonal status.
All right, y'all, Dr. Collier, good morning.
My name is Renee, calling from Louisville. I wanted to ask the doctor, does BioT pellets work for men who have had prostate surgery?
Absolutely. That's amazing. That question led right in. Yes, I do. Probably more men than women. And originally, it was thought that men that had prostate cancer could not get supplemental testosterone therapy. That's one of the things that they get in a pellet. But now we have realized that that's not a direct correlation between testosterone and prostate cancer, and that once a man has been treated and had prostate disease resolved for, they used to say 5 years, and then they said 2 years, and now they're saying pretty much right after it's treated, you can get a bioidentical hormone replacement therapy for men, and that, again, is life-changing. It's the fastest of you fellas. It makes you like you were when you were 18. The wind blows, and you respond.
Wow. Hey, I appreciate that. And
Come on now.
That's what we need, Dr. Collier. Just the wind to blow.
The wind blows. You respond in the appropriate manner. Okay. So these are the opinions of Dr. M.J. Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew. Rickey, you can reach me on all social media at AskDrMJ. Ask Dr. MJ. Go to my YouTube channel for videos on health topics, and go to my website, lipodrops.com, where you'll find information on supplements that will keep you healthy and help control all of your perimenopausal and menopausal symptoms. My Lipo Hers is a great product for that, and my Lipo Tea for the men as well. And remember, Rickey, we looking forward to the birthday beach bash, man. The Diplomat Hotel, a 5-star facility with amazing atrium area. Come on out and hang out. You're going to be glad that you were there. Stay. Don't you dare go away. You listening to Dr. MJ on the Rickey Smiley Morning Show.